Hello, I'm Dr. Susan Connolly, consultant cardiologist and clinical lead for the Our Hearts, Our Minds programme, which is delivered by the Western Health and Social Care Trust. I want to describe to you briefly today what the programme entails and why you should consider joining it. Imagine there was a pill that you could take if you'd had a heart attack or a stent put in, and that pill reduced your risk of dying by 60%, your risk of a heart attack by 30%, your risk of a stroke by 30%, you would want to take that pill. But actually it's not a pill, it's a treatment called cardiac rehabilitation. It's not a very patient-friendly term. It sounds a bit like young offenders doing rehabilitation. But what does it mean? Well, it was defined by the World Health Organization over 40 years ago as the sum of activities required to influence favourably the underlying cause of the disease, the cause of the heart problem, as well as to provide the best possible physical, mental and social conditions so that patients may, by their own efforts, preserve or resume when lost as normal a place as possible in the community. What does that really mean? These are the British standards for cardiac rehabilitation. There are 4 essential components. Managing your lifestyle risk factor management, not smoking, eating healthily, regular physical activity. Medical risk factor management, making sure your blood pressure and cholesterol are well controlled. Psychological health, making sure you're managing your emotions in a healthy way. Cardioprotective medications, making sure you're taking the right medications for your heart condition at the right doses. And underpinning all of this is understanding your condition and empowering yourself and taking charge. So by the end of the programme, you have self-efficacy. Our Hearts, Our Minds is our name for our cardiac rehabilitation programme run in the Western Trust. And this is a picture from the programme leaflet. Up to this point, we were running the programme in the hospitals in Enniskillen, Omagh and Athnagalvin. The programme would start with a detailed assessment by our very skilled team, a nurse, dietitian, physical activity specialist or exercise specialist, sometimes a psychologist. And then we deliver a 10-week programme in our local leisure centres across the Trust in Omagh and Enniskillen and in Derry in the Foyle Arena and the Templemore Complex. During this programme we deliver educational sessions and group exercise sessions, empowering you to make healthy lifestyle changes, making sure your blood pressure and cholesterol are managed, making sure your medications are right, addressing any anxieties and concerns that you have, liaising with your GP so they know what's going on. And then we repeat the assessment at the end of the programme to see your progress and liaise with you over that. And we also repeat the assessment at 1 year. But now we're asking you to take part in virtual Our Hearts, Our Minds. Well, why is that? Well, we're in unprecedented times in this COVID era. We want to avoid unnecessary face-to-face consultations with you. We are unable to run the group exercise classes as we used to. Therefore, to make sure we can continue to provide you with this life-saving service, we're moving it to a virtual platform. And we're learning as much about this as you will be. What is this virtual programme going to look like? The programme will start with an initial assessment as before by the multidisciplinary team. But this time the consultation won't be face-to-face. We want to avoid bringing you into the hospital environment unless we have to. Therefore, we will be offering you a consultation either through the telephone or a video consultation which you can access through a smartphone or a tablet. We will ring you in advance and see what you would prefer and offer you whichever solution suits you. We are going to run virtual group sessions, so you'll be able to conference call with us and interact with other patients and with our team, and you'll have the opportunity to ask questions, raise concerns about your condition, and we'll do our very best to deal with those questions and concerns. Also part of this virtual program are online educational videos filmed by our multidisciplinary team. They will cover a range of topics that are important for you to be aware of in managing your cardiovascular health. On stopping smoking, on making healthy food choices, on exercise and physical activity, on the causes of heart disease and understanding the treatments, on what medications you should be on to optimize your cardiovascular health, on the psychological aspects of cardiovascular disease, as there is a psychological impact. These will be available on the Trust's YouTube channel, and if you go to our website, you'll be able to access these directly. We will continue to liaise regularly with your primary care practitioner, and through them and your practice-based pharmacist, we will be able to up-titrate your medications as normal. We are also introducing Fitbit device. That is a device you wear on your wrist. It looks like a watch, but it'll help us track your physical activity and your heart rate. And most importantly, it'll help you track your physical activity and your heart rate, and you will get instant feedback to see how you're doing on a day-to-day basis. And you can share that data with us if you like. We will be finishing the program with another assessment after about 12 weeks to see how you're doing. Again, that'll be a telephone consultation or a video consultation. You get to choose. We hope you enjoy the program, and we look forward to either talking to you on the telephone or meeting you virtually online. Thank you very much.